Hello students, welcome to another episode of Daily Drug Study. Today, you will learn about the autobiography of Class 1B antiarrhythmic drugs. For you to understand these drugs better, I have invited Ms. Lidocaine to discuss the topic herself. Learning is best when you're having fun. So before we start, go grab anything like snacks that will help you enjoy this video. Hi, I am Lidocaine, a Class 1B antiarrhythmic drug. Lidocaine is my generic drug name, but you may also know me by my several brand names. When I am administered parenterally, my brand names are Lidopen, Lidocaine, and Lidocaine. However, when I am used in mucosal administration, my brand names are Anastacon and Lidocaine viscous. Lastly, when I am used as a patch, my brand name is Lidoderm. Apparently, I have too many names, but I believe familiarizing each of them will be very beneficial to you. Now that I have finished introducing my names, let me talk about my classifications. As I have mentioned earlier, I am therapeutically classified as a Class 1B antiarrhythmic drug. To give you a general idea, I am used to treat ventricular arrhythmias by shortening the duration of the refractory period. Aside from this, I also have a pharmacologic classification, which is an amide derivative. Also, my pregnancy category is Category B. This means that adequate studies in pregnant women have shown that I have no risk to the fetus during the first trimester of pregnancy, and there is no evidence of risk in later trimesters. So far, what do you think? Aren't I interesting? Don't worry, there's more. So, what do I do once I am administered in or on the body? What I do is I suppress the automaticity and spontaneous depolarization of the ventricles during diastole by altering the flux of sodium ions across the cell membranes when it binds and blocks sodium channels. With this, there is an inhibition of the ionic fluxes required for the initiation and conduction of electrical potential impulses that are necessary to facilitate muscle contraction. You might be wondering how I am absorbed, distributed, and metabolized. To answer you, let's move on to my pharmacokinetics. I am well absorbed in the deltoid muscle after administration, and I am ultimately distributed throughout the body tissues, but generally, I am concentrated in the adipose tissues. Moreover, my determined volume of distribution is 0.5 to 1.5 liters per kilogram. I am metabolized predominantly and rapidly in the liver and excreted by the kidneys. My half-life is biphasic. During the initial phase, my half-life is 7 to 30 minutes, while during the terminal phase, my half-life is 90 to 120 minutes. Lastly, my clearance rate is 0.6 plus or minus 0.18 liters per minute. Let's move on to my indication and contraindications. I am specifically indicated to treat supraventricular tachycardia and premature ventricular contractions or PVCs, and the management of acute ventricular arrhythmias during cardiac surgery and IV use. On the other hand, I am contraindicated to patients with hypersensitivity and third-degree heart block. Also, I must be used with caution in patients with liver disease, CHF, respiratory depression, shock, geriatric patients, and pregnant or lactating women. Just sit tight, everyone. We are already halfway through the discussion. Like any other drugs, I also have adverse effects per body system. For the nervous system, common are seizures, confusions, drowsiness, blurred vision, dizziness, nervousness, and slurred speech. For the EENT, my side effect is the absence of gag reflex. For the cardiovascular system, common are cardiac arrest, arrhythmias, bradycardia, heart block, and hypotension. For the respiratory system, I can cause bronchospasm. For the gastrointestinal system, my adverse effects are vomiting and nausea. Lastly, for the local, common are stinging, burning, contact dermatitis, and arrhythmia. Well, that's about it. Miss Anne will be the one to discuss the nursing responsibilities before, during, and after my administration. Hello again, everyone. I'm pretty sure that you're excited to know the nursing responsibilities. So, let's begin. Before administration, check BP and cardiac monitor prior to lidocaine administration. Also, for throat sprays, make sure that the patient's gag reflex is intact before allowing the patient to eat or drink. The nurse must also determine if the client has any contraindications of the drug. Determine if client is taking or intends to take both drugs or food that interacts with lidocaine. Also, confirm that the client understands both the benefits and risk of the drug administration. Lastly, the nurse must carefully read the instructions of administration. During drug administration, the nursing responsibilities are: first, monitor the ECG continuously. Blood pressure and respiratory status should also be monitored frequently during the drug administration. Serum lidocaine levels should be monitored frequently during prolonged use. Therapeutic serum lidocaine levels range from 1.5 to 5 mcg per ml. Also, for stable patients, doses should be given slow IV push at 25 mg per minute. The nurse must also monitor blood pressure and cardiac monitor during therapy with lidocaine. Lastly, do not breastfeed while taking this drug without consulting a physician. After drug administration, the nursing responsibilities are: assess neurological and respiratory status frequently for signs of toxicity. Also, if signs of overdose occur, stop the infusion immediately and monitor the patient closely. Watch for neurotoxic effects, example drowsiness, dizziness, confusion, paresthesia, visual disturbances, excitement, behavioral changes in patients receiving IV infusions or high lidocaine blood levels. Lastly, the nurse must consider lidocaine toxicity if patient appears to be upset or agitated. If toxicity is evident, simply discontinue IV infusion so that the serum levels drop in 10 to 20 minutes.